Alright, kindly turn on your video so I can see my students. Start are going to start now. Thank you. Remember, it's good that your professor knows you. They see you and they recognize you are one of them. So make sure when you attend, you turn on your videos so you are recognized. If there is face-to-face classes, I assure you that I have known half, if not all, of what is the number? 90, I think, participants. 80 participants today. Right? So, group. And if I see you face to face on a daily basis, almost you will be known. But unfortunately, online. So unless you make your mark, you will not be remembered. And how do you make a mark? Of course, if you answer, if you participate, that's how, right? You ask questions. All right. Our topic for today is a lot. It's like half of your leg in one sitting. So we're going to hope
I would like to say that this topic hasn't discussed in our class yet. We have the lecture tomorrow.
again.
Yes,
Again,
ma'am.
I don't like that they put my lab before a because it gives you an alibi not to answer my question. All right. So if it hasn't been lectured to you, then I will know who are the people or who are the students who read ahead. All right. Meaning who are the smart ones. Because the smart ones, they read ahead of you. If today the topic is leg, they're already done with that. They are ready to read the next chapter of your anatomy book. All right, so let us start getting to know who are those smart students of this group by starting with the knee joint. All right, who doesn't know their knees? This is a very, very easily recognizable part of your body. And with that, you have to know what are those parts that you can touch or you can see, actually see. So this is called surface anatomy. In this laboratory session, you will know the surface anatomy, you will know the bones, the muscles, the blood vessels and nerves that are found in the area that we are supposed to study today. And our topic is 50% of your lower limb from your knee down. Alright? So this is the start of our area, the knee joint. So in the knee joint, the most recognizable is your patella. This is where you kneel. When you kneel on your patella. Alright, so this is the patella. This sesamoid bone anteriorly. Alright, and these are the recognizable parts that you can feel on your leg when you try to touch the knee joint. If you touch the lateral side, so on the side, you will feel the lateral epi. So the lateral epicondyle on the lateral side. If you feel on the other side, on the medial side, you will feel the medial epicondyle. Moving downwards to the lateral epicondyle, you will feel the medial or the lateral tibial condyles. Okay? Of course, the medial will be inferior to is the medial lateral tibial condyle. Okay? And then, this is a very prominent, and sometimes when you stand, you can actually see this prominence. And this is your tibial tuberosity. This is your tibial tuberosity. You can actually see it. All right, when you stand straight. So when you face the mirror later, try to see if you can appreciate these structures that we are identifying right now. Then on your lateral side, you can actually feel your tibia, the medial surface and the anterior border of your tibia. You can actually palpate it. So these are the structures, the green ones are the structures that you can actually feel when you touch your knee joint. Alright? So I encourage all of you to do this, face the mirror, try to touch the knee joint, and appreciate what are these parts of the bone that you can actually see and feel in this area. Now we're done with that. Let us now go to the next part, which is what are the structure on this knee joint. All right. First, superiorly, you will find the quadriceps tendon. Okay, there's a quadriceps tendon and enclosing the patella. Inferiorly, you will find the patellar ligament. The patellar ligament. The quadriceps tendon and the patellar ligament make sure that the patella is always where it should be. On top of that, there are your medial and lateral retinaculum. There is a retinaculum on each side, a lateral and a medial, keeping it in place as well. Alright? The other structures are just in the knee joint, but doesn't contribute to the integrity or to the stabilization of the patella. Alright? You can see your iliotibial tract or the iliotibial band. You can see the the tendons of different muscles in the area. But the most important thing is the quadriceps tendon, the patellar ligament, the medial and lateral retinaculum. So you should be able to know these parts. So again, let us try to remember what do you call this one on top?
Quadriceps. Quadriceps ligament. Tendon.
Quadriceps femoris
Ligament.
Quadriceps femoris.
Ligament.
It's a tendon.
Quadriceps tendon.
How about this
tendon.
one?
Patellar ligament.
Patellar ligament. How about this side?
Lateral.
Lateral retinaculum. How about on this side?
Medial reticulum.
Retinaculum. So I hope you will remember that, those parts, all right? Let us now explore the bones of the knee joint. So we studied already the patella. We already identified the lateral and medial condyle, which can be appreciated in the surface anatomy. All right? You have your tibia and your fibula. Now, you should not be confused with the tibia and the fibula. The tibia is the big bone, the fibula is the thin bone. Okay? And you should easily identify if it is right or left. The tibia is towards the middle. Right? So, where the fibula is located, that is the side. So, this one, what is the side of this?
Right side. Lateral.
The right leg. Kasi the fibula on the right. Alright? The fibula is on the right. This is the right leg. Right? And on the knee joint, you will appreciate as well the tuberosity, the tibial tuberosity, the condyle, the lateral and medial condyle of the tibia, as well as the head of the fibula. Okay, so that is your knee joint. Now, on the knee joint, the knee carries your weight. So if you are 70 kilograms, it's 70 kilograms resting on your knee when you stand. So it has to be strong. That is why there are several ligaments keeping it together in place. All right? So we now study the different ligaments that can be found in the knee joint. So first we have the medial collateral ligament. So how will you know it's the medial collateral ligament? It's on the tibia side. Medial collateral ligament. On the other side, on the fibula side, you have lateral collateral ligament. So medial on the tibia side, lateral on the fibula side. Next, at the middle, there are two X. They are like X, position like X or crossing each other. Right? It's the anterior and posterior cruciate ligament. Anterior is coming from the anterior side, going to the back side. So that is your anterior cruciate ligament. The posterior cruciate is coming from the back. So that's why you cannot see it here. If you see the patella, the ligament that is at the middle is the anterior cruciate ligament. If you don't see the patella, then the ligament that you can see is the posterior cruciate ligament. All right? Next, now the meniscus. These are the easily injured part of your knee joint. The medial meniscus and the lateral meniscus. Right? Lateral meniscus towards the side of the fibula, medial meniscus is on the other side. So again, what makes the knee joint strong? The ligaments that it has. It has a medial collateral ligament, a lateral collateral ligament, the posterior cruciate, and the anterior cruciate ligament. On top of that, there are menisci, the medial and lateral meniscus. Tomorrow, you will learn more about this structure. Today is a laboratory, so our concern is to make sure that you identify these parts when it is presented to you. Alright, so let us try to identify using a different image. What could be letter A?
Medial collateral
Medial
Lateral
Lateral
ligaments.
meniscus. Lateral
lateral ligament. Lateral.
Lateral collateral.
Lateral. Remember, fibula is on the
Fibula.
lateral. So this is
Lateral collateral.
lateral ligament. How about E?
Medial
Medial.
Collateral.
Medial.
medial.
Collateral.
Medial collateral ligament.
How about C?
Anterior.
Posterior
Cruciate ligament.
It's posterior.
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 What do you think is the
It's
position
posterior.
of this? Is this anterior or posterior?
Anterior. Anterior.
Anterior.
What made you say it is anterior?
No, no, it's posterior.
Posterior.
There is no
It's posterior
patella.
because there is no patella.
But sometimes they don't put the patella, but look at the bone.
Bone is yes. Tuberosity is
It is not there.
You can see the tuberosity. Therefore, is it facing you or at, is it anterior or posterior? Is this facing you? The back.
It's anterior. Yes, ma'am. It is anterior.
You see the tuberosity, that means it is facing you. Therefore, it is anterior. So what is C?
Anterior. Anterior cruciate ligament.
Cruciate ligament.
What is B?
Lateral
B is
meniscus.
Lateral meniscus.
lateral meniscus.
Lateral meniscus.
Medial meniscus.
Lateral meniscus.
The
That is
It is
medial meniscus.
Medial.
medial meniscus. Medial meniscus.
Medial meniscus.
So these are the other images that you can find if you do some research on the knee joint. But it always tells you the same parts. Alright? You will always see the same part. As you can see here, the medial, ay the lateral, collateral ligament is labeled here as fibular collateral ligament. Some books have that, but it's still the same. But the most common is the lateral and medial collateral ligament. Those are the most commonly used term for it. But other books have other terms, but we use what is universal, meaning most of the books are using. In this view, which is looking from above, all right, coronal view, there's another ligament that you can see. And this is covered by the patellar ligament. That's why we don't see it anteriorly. And this is called the transverse ligament of the knee, adding another protection to the knee joint. So you can see there's a lot of bands making sure that your knee joint remains in. So make sure that you know the structures that comprises your knee joint. Now let us now go to the back. Now let us look this joint from the back. This is now called the popliteal fossa. So this is now the surface anatomy of your popliteal fossa. When you look at someone's popliteal fossa, these are the structures that you can actually see. First, the space is the popliteal fossa. Then at the side, so where do you think is the lateral and medial here? Which one is lateral, which one is medial? What side is this?
That is lateral.
Lateral.
Left one is lateral, and the
Lateral.
right one is medial.
Lateral, this is medial. How did you know? You know
Medial.
by
The biceps femoris muscle.
very good. You know if this is not labeled, of course you don't know which is which. But you know it by the concavity that is made at the side. Right? The concavity is towards the middle. Okay? So that's how you will know the laterality. So, what are the things that you can appreciate? When you look at the back, you can see a ridge, an elevation. And that elevation is the bicep femoris muscle, the tendon of the bicep femoris muscle. On the other side, it's another tendon, the semitendinosus muscle. So bicep femoris, semitendinosus. Those are the muscles that you can appreciate at the popliteal fossa. And inferiorly, you can see the head of the gastrocnemius. The head of the gastrocnemius. All right? So those are the structures that you will appreciate when you look at the that side. So let us now see what are the things that we can see. As you can see, the concavity is on this side. Therefore, this is the medial side or the middle side. And we can see here the bicep femoris, the semimembranosus, the semitendinosus, the gastrocnemius, the medial and lateral head, and the plantaris. Therefore, these are the boundaries of your popliteal fossa. The same muscles are the boundaries of popliteal fossa. Now, as you are in MS, you have every muscle that you encounter. You have to know the origin, insertion, innervation, blood supply. Right? And these are important when you have your theoretical exam. In the practical exam, all you have to know is where they are located. Because by knowing where they are located, you can guess where are they inserting or attaching or originating, unless you don't know the parts of the bone, because they all came from the bone. So if you know the area, you will be able to appreciate where they are originating or where are they inserting. All right. Now, at the popliteal fossa, there are structures that you can see. As you can see from here, the skin is taken off and the fats around it. So this is now what you will see. If you have the chance to dissect the cadaver, these are the structures that you will be able to find when you dissect that cadaver posteriorly. So, first, you will find the popliteal artery. Alright? So, first, let us identify which is medial, which is lateral. Which is medial, which is lateral.
Left side is medial.
Right side.
Lateral.
Oh, it has a label, right leg. So you don't have to think. There's a label, right leg. So therefore, this is the right. So if this is the right and you're looking at the back, this is middle, this is lateral. So you have now the muscles that we have identified a while ago. You have plantaris, biceps, femoris, semimembranosus, semitendinosus, and the gastrocnemius. Now, what are the contents of the popliteal fossa? You have artery, vein, nerve. AVN. Artery, vein, nerve. Alright? So, the first thing that you will see is the popliteal artery, followed by the popliteal vein. And then the tibial nerve. So this big nerve that you can see in the popliteal fossa is the tibial nerve, which is the innervation of most of your leg muscles. Alright? And then there's a small branch on the lateral side. This is the common fibular nerve or peroneal nerve. Common fibular nerve or peroneal nerve. Sorry for that, but I was just informed that my meeting is going to end out instantly. Let me just Dr. Manito.
Sudah magulo to.
Alright, if we get cut off, since Ama did not pay their Zoom account, kindly log on again. Alright? Because they're supposed to provide us with limitless meetings. Alright? So anyways, that's Ama.
Ma'am, that APL sequence is same for both right and left leg.
Yes, it is.
It's from
It is
medial
the
to
same
lateral.
sequence. Whether
Medial to lateral.
medial, yes, it's the same. All your muscles are mirror. They're mirror image, alright? So
Okay.
when you study the right, you just have to flip it, it will be on the left. Alright? It's the same. The lateral most muscle is the lateral most muscle on the same whatever side you're going to study. Alright? That's a very good question. Thank you for that question. Alright, let us now go to the leg. The leg, alright? This is the biggest part of our lecture for today, the leg. So, superficially, what do you see in the leg? These are what you're going to see. The most that we see is the gastrocnemius. Whether you're looking from behind or from the anteriorly, it's the same. You can see the gastrocnemius. It's a very big muscles. Dr. Maniwa doesn't believe me. Alright, anyway, sorry for that in the first place. Alright, so moving on. So remember, you have to know your surface anatomy. Alright? It's nice to know your surface anatomy. If you especially if you want to be surgeons someday. Alright? I hope there's to be surgeons someday. Oh, I can see some who are smiling. Maybe they want to be surgeons someday. Okay? So, here at the back, what do we see at the back? So, we know now anteriorly. How about posteriorly? So, posteriorly, these are the things that you will see. Of course, the lateral head and the medial head of the gastrocnemius, your semitendinosus and your semimembranosus, your biceps femoris, all right? And This is just identifying the border of the popliteal fossa. But we are after the what you can see in your posterior superficial anatomy or surface anatomy. Now let's go to the bone. There are two bones, and you already know these two bones, the tibia and the fibula. Alright? Tibia and fibula. As Filipinos, we